Adipose tissue plays a crucial, yet often overlooked role in maintaining blood glucose stability by acting as an active sink for circulating glucose after meals. Healthy adipocytes express high levels of the insulin-responsive glucose transporter GLUT4, which enables them to rapidly take up glucose from the bloodstream when insulin levels rise following carbohydrate ingestion. This glucose is then converted into glycerol 3-phosphate, a key building block for synthesizing triglycerides, effectively storing both energy and carbon skeletons for future use. While skeletal muscle is often highlighted as the major site of postprandial glucose disposal, adipose tissue also contributes substantially to glucose clearance, especially under conditions of high insulin levels. By absorbing glucose efficiently when blood sugar spikes, adipocytes help prevent post-meal hyperglycemia, a state of elevated blood glucose that, if repeated chronically, damages blood vessels, nerves, and organs. This buffering function is critical because even small, repeated elevations in glucose levels can increase the risk of complications like retinopathy, nephropathy, and cardiovascular disease. Moreover, adipocytes indirectly support glucose homeostasis by influencing insulin sensitivity in other tissues. Through the secretion of adipokines such as adiponectin, healthy fat depots enhance the responsiveness of liver and muscle to insulin, promoting further glucose uptake and reducing hepatic glucose production. This systemic crosstalk highlights that adipose tissue doesn't just passively store glucose, it actively coordinates whole-body glucose regulation. The protective role of adipose tissue as a glucose sink becomes even clearer in conditions where fat storage capacity is compromised. For example, in lipodystrophy, a disorder characterized by an absence of functional adipose tissue, patients develop severe insulin resistance, extreme hyperglycemia, and fatty liver disease despite having little or no body fat. This paradox arises because without adipocytes to take up and store glucose, excessive carbohydrates in the diet cannot be safely sequestered, leading to toxic elevations in blood glucose and lipid levels. On the other end of the spectrum, dysfunctional or inflamed adipose tissue, common in obesity, can impair GLUT4 expression and insulin signaling within adipocytes themselves. When fat cells become insulin resistant, their ability to take up glucose after meals declines sharply, shifting the burden of glucose clearance to skeletal muscle and liver. If these tissues also become insulin resistant, hyperglycemia ensues, setting the stage for the development of type 2 diabetes. Emerging research suggests that therapies aimed at restoring healthy adipose insulin sensitivity, whether through lifestyle interventions like exercise and balanced nutrition, or through medications such as thiazolidinediones, can improve the ability of fat cells to absorb glucose, thereby enhancing whole-body glucose homeostasis. Such strategies reinforce the concept that well-functioning adipocytes are indispensable allies in keeping blood sugar levels within a healthy range. Altogether, these findings make it clear that adipose tissue is not merely a passive bystander, but an active participant in blood glucose regulation. By efficiently absorbing glucose in response to insulin, healthy fat cells protect the body from harmful swings in blood sugar, stabilize energy supply, and reduce the risk of long-term metabolic complications. This dynamic role once again underscores how essential adipocytes are to systemic health, highlighting their value as key regulators of glucose homeostasis alongside muscle tissue.